And we can actually go live now to the Eagle's Nest, which today I believe is the conservatory in the home of our Chief Executive, Nicky Conway. Hi, Nicky. Good to hear from you.
Hi, Chris. How are you? Reading you loud and clear.
Good, good. Well, it's great to see, I suppose, anybody else during these times, but how are you and the family coping and adapting to lockdown?
I think like anyone else, we're finding aspects of it challenging, missing seeing the wider family, missing my regular squash matches, but we're just looking at, I suppose, how we adapt. One of the things that I found helpful is regular routines, so getting into routine with the kids and homeschooling, getting into routine in terms of exercise. We're fortunate that we have a garden, so the weather being good has helped a little, so we're trying to make the most of that, playing some badminton, doing some camping out. Doing some artwork as well. I don't know what you can see behind me. This is my son's attempt at Picasso.
It's excellent.
Today. Hopefully it's not me.
the likeness is uncanny.
To be honest with you, the kids have been great. It's some of the other residents of the house have been more problematic. So we have a dog, a cat, and a lovebird. The cat has chewed through the internet cables just before a board meeting, so that wasn't ideal. The cat also chased the lovebird onto the top of my head before one of the meetings. The dog's been reasonably well behaved, so really it's the cat and the bird are the two problem characters.
Right, okay, so that old saying, don't work with children and animals doesn't really fit whenever you're locked in four walls together.
No, definitely not animals.
Definitely not animals. Well, it sounds like it's certainly a busy household, and of course, all of this while still working from home. So, how have you found trying to run a busy organisation like BCM remotely?
Yeah, I mean, I suppose my primary job is to lead the organisation and lead it through these difficult times, and really to ensure where possible we can continue to deliver services to the vulnerable people with whom we work. So that has its challenges. I suppose early on we had to make some difficult decisions to temporarily close some projects. So Puddle Ducks was closed, Room Hire as well, and some aspects of our headquarters work. So we took those decisions fairly quickly, fairly promptly, really to protect the staff involved. We couldn't continue to operate there. We also had to look at how we resource people to work from home. So there was a big piece of work there in terms of getting people the right equipment to do that. So all of that has now been put in place, and I'm pleased to say we're now starting to look at, I suppose, what coming out of this situation might start to look like. Now, obviously, very early days. We're keeping a close eye on the Northern Ireland Executive's 5-step plan, and at this stage, there's no timescales attached to that. But I suppose starting with thinking about what opening up certain aspects of our work might look like again. I'm really encouraged to say that construction's now started on the Copeland site again. So I suppose that's one of the first steps in getting back to some level of normality there. So that's really a focus of my time, the leadership's time, and the board moving forward.
As you just outlined there, BCM is such a huge and diverse organisation. How have you found trying to spin so many plates from, so remotely?
Yeah, I mean, that's always a challenge. It's been a challenge from day one when I started with BCM. The diversity of the organisation is a challenge, but it's also an opportunity because we provide so many different aspects of our work. In some ways, that insulates us against some of these current difficulties. So some of our services have been able to continue. I really have been full of admiration for the way that our staff in the front line have adapted and carried on and really put their service users and their services at the forefront. It has meant we've had to do things differently in certain cases, but that really doesn't seem to have phased them. They've adapted and continue to provide the service. And in some instances, I suppose the changes have actually prompted a better response in terms of, for example, therapeutic counselling. We've been inundated in terms of young people accessing that service remotely through telephone support. So there are some positives to come out of this situation as well. And I suppose that's one of the things that I and the leadership team are looking at to see whenever we are able to return to the new normality, whatever that will be, what positive things have come out of this situation in terms of technology and how can we use those and adapt to those to our work moving forward.
Mm-hmm. And you mentioned that the rise in therapeutic counselling and the requirement for that, and obviously PPAs was mentioned as well in terms of frontline having to use those on a greater scale. What other issues have been cropping up during lockdown across the projects?
I mean, beyond the practical implications of keeping staff safe, and I suppose some of the other things we've done there is invested in additional cleaning regimes, also looking at additional staffing where required. I suppose some of the challenges, for example, in our supported housing for young people is all of us are finding lockdown challenging, but for some of those vulnerable young people with whom we work, that's particularly challenging and difficult for them. So we're looking at creative ways where we can provide supports to them and different interventions to try and make lockdown a bit easier. That will have resource implications. So again, we need to look at ways of trying to find additional funding to support that.
And that support for the whole organisation will come in various forms, whether it's PPE or supplies, things like that. We obviously received a message from David Campton last week just in terms of pastoral support, and I suppose in terms of something a bit more personal, how have you and the leadership team been focusing on that over the last number of weeks?
Yeah, I mean, absolutely. I suppose, and the practical end of things, you already alluded to and touched on it. So the PPE, making sure we have a good supply there, additional staffing where required across our residential services, also looking at increasing the cleaning regimes where needed. But I mean, that's really focusing on the practical and the health and safety issues. The longer this situation goes on, then the longer it has an impact on people's mental health and well-being. And that's something we're very conscious of as a leadership team and the board. So it's looking at things like we already have our Westfield Health programme, so staff can access counselling there as part of that support. David's service, as you touched on, in terms of pastoral care. We've also been very fortunate that Leona Larkin's husband, Martin, has volunteered. He's a qualified counsellor, has volunteered his time to support our staff. So we're really looking at any sort of measures like that to really try and support the mental health and well-being of our staff. We've developed a detailed mental health and well-being policy, and Dominic at HR is leading on that. So those are some of the things we're thinking about, but I suppose we have an open mind in terms of what other things we can be doing to help. And I would really welcome any ideas from staff if they would forward them through either their line manager or Dominic at HR. We'll certainly give them consideration.
And I suppose on that note, is there anything that our supporters who might be listening to this can help or do in the broader scheme of things?
Yeah, I think there's a range of things there. I mean, I suppose our sources of income, like most charities, have been negatively affected by the impact of COVID. So we would normally do appeals out to our donors. One of those and possibly two of those will have to be deferred. Also, I suppose the impact of closing down Puddle Ducks temporarily and room hire has all impacted our income. So people can continue to donate, and I would encourage them to do so through our website. If that's not possible, we've also received gifts in kind. We had a very generous donation of Easter eggs to the staff at Kirk House and residents. So again, that was very gratefully received. Again, in terms of practical support, we are handing out food packages where required. Other practical supplies such as nappies and our parent support project. So there's a range of things that people can do to help us practically. But even just messages of support, I know, are very gratefully received from the staff who are continuing to deliver the services on the front line.
Definitely, and I know that a lot of the projects have been sharing those with us, for use across the Viz or social media or anything like that. So I suppose I don't want to take up any more of your time because you probably have 16 more meetings after this. So is there anything else that you'd like to share or say to our colleagues across BCM?
I really just wanted to finish by saying I'm conscious these are difficult times for people, but BCM has been around for over 130 years, and I and the board are confident we will come through this crisis the way we have in previous times. We'll come back stronger, we'll come back more resilient, and that will be down to the professionalism and dedication of the staff team. And I just want to take the opportunity once again to say thank you to you all.
Great. Thank you very much, Nicky. I'm sure you've got a few more meetings to do today, so I'll let you get back to them, but thanks so much for your time.
Okay, thanks, Chris.
No problem.